MedMen Clear Detect COVID-19 Antigen Home Test User Instructions. This product is for emergency use authorization, EUA only, and in vitro diagnostic use only. Carefully review this video prior to completing your test. If possible, it may be helpful to review the instructions included in your test kit or available online from the MedMen.com website before beginning. It's recommended that gloves, which are not provided, be used during testing. Prepare for test. Before you begin, check the expiration date printed on the back of the test kit box next to a QR code. Wash or sanitize your hands and make sure they are dry before starting the test. Ensure you have a clean space to work prior to testing. Kit contents. Required testing components. 1 swab, 1 test strip and pouch, 1 tube of sample buffer. A timer, which is not included, will also be needed. Note: this kit comes in 1, 2, 4, and 25 test kit quantities. The number of items supplied in the kit will vary depending on which kit is purchased. Test procedure. Step 1. Stand up tube and remove cap. Place the tube upright in the tube holder. Remove the cap. Do not discard. Save the cap for use in Step 9. Step 2. Open swab. Warning: do not touch the swab tip. Open the swab package at the stick end. Take out the swab. Step 3. Swab both nostrils. Gently insert the swab tip into one nostril about 1/2 to 3/4 of an inch. Do not insert the swab any farther if you feel resistance. Using medium pressure, rub the swab tip against the inside wall of your nostril. Make at least 5 large circles in about 15 seconds. Do not just spin the swab. Step 4. Swab other nostril. Attention! Using the same swab, repeat Step 3 in the other nostril. Note: both nostrils must be swabbed to ensure accurate results. Note: if you are swabbing others, please wear a face mask. With children, you may not need to insert the swab as far into the nostril. For very young children, you may need another person to steady the child's head while swabbing. Step 5. Insert swab into tube and mix. Completely submerge the swab tip into the liquid inside the tube and set a 30-second timer. Attention! Firmly press the tip to the bottom of the tube. Repeatedly plunge the swab for 30 seconds, which is approximately 30 to 60 plunges or more. Mix by firmly pressing the swab tip to the bottom of the tube with each down motion. Note: this step is very important. Do not mix for less than 30 seconds. Incorrect or invalid results may occur if the mix time is too short. Step 6. Break swab. Make sure the swab tip is in the liquid inside of the tube. While using one hand to securely hold the tube down, use the other hand to carefully break the swab handle against the side of the tube. It should break in the middle. Discard the swab handle and leave the broken swab tip in the tube. Step 7. Insert test strip. Open the test strip pouch carefully at the tear notch. Hold the side of the test strip marked MedMen COVID-19. Warning: Do not touch the rest of the strip. Carefully place the strip into the tube, facing outwards, so the results window is clearly visible. Note, if test strip is inserted upside down, discard all test components and restart from step 1. Do not touch the results window, as it can cause false results. Step 8. Securely cap tube. Caution: keep the tube upright during the entire test. Make sure the test strip touches the bottom of the tube. While keeping the tube upright, secure the twist cap on the tube. Step 9. Wait 15 minutes. Caution: do not disturb the tube during this time. Read the results at 15 minutes with good lighting. Do not read the results before 15 minutes or after 30 minutes. If the tube is disturbed prior to or during the 15-minute wait time, restart the test from step 1. Note: false results may occur if the test is read outside the recommended time period. When reading test results, remove the test strip from the tube if necessary. Interpret results. COVID-19 positive. If the control line and the test line are visible, the test is positive. Any faint visible reddish-pink test line with the control line should be read as positive. Attention! Look very closely. Even a very faint pink test line and control line is a positive result. Any red or pink line here is positive. You do not need to perform repeat testing if you have a positive result at any time. A positive test result means that the virus that causes COVID-19 was detected in your sample, and it's very likely you have COVID-19 and are contagious. Please contact your doctor or primary care physician or your local health authority immediately and adhere to the local guidelines regarding self-isolation. There is a very small chance that this test can give a positive result that is incorrect, also called a false positive. COVID-19 negative. If the control line is visible, but the test line is not visible, the test is negative. To increase the chance that the negative result for COVID-19 is accurate, you should test again in 48 hours if you have symptoms on the first day of testing. Test 2 more times at least 48 hours apart if you do not have symptoms on the first day of testing. A negative test indicates that the virus that causes COVID-19 was not detected in your sample. A negative result is presumptive, meaning it's not certain that you do not have COVID-19. You may still have COVID-19, and you may still be contagious. There is a higher chance of false negative results with antigen tests compared to laboratory-based tests such as PCR. If you test negative and continue to experience COVID-19-like symptoms, for example, fever, cough, and/or shortness of breath, you should seek follow-up care with your healthcare provider. Invalid result. If the control line is not visible, the test is invalid. Retest with the new swab and new test device if you have an invalid result. Dispose in trash. All used components should be disposed of in household trash.